We just completed our discussion on the neck and head and the muscles that we care about there. Let's go ahead and descend down into the thoracic and abdominal pelvic cavity. Beginning with the uppermost, you'll see here that we have a deltoid muscle. The deltoid muscle, we're in the frontal aspect. If we were to go ahead, you'll notice it has an insertion point here on the clavicle, as well as if we rotate around, you'll see these tendons inserting onto that spine of the scapula. So based on that, you'll see that you also have three different bellies of that deltoid, all three of which have different function because of their fascicles. This one obviously drawing back or extending the arm at the shoulder joint, with some assistance in abducting the muscle or abducting the arm. This more medial or intermediate belly of the deltoid, abducting it primarily, with that anterior one helping draw that arm more forward and flexing that arm. If we go ahead and continue down into the thoracic region, into the anterior portion, you'll see a pectoralis major. Its insertion point being again in that deltoid tuberosity that we discussed about. It's all coming together now, right? Anyway, so that pectoralis major, you can see you can do some deadlift, not quite deadlifts, forgive me, some bench presses and things like that. The muscles, by the way, that at this point, now that I think about it, we will be discussing the muscles in general, that if you have worked out, if you have exercised, if you had paid attention in PE, these terms have been flipped around and used around. We're going to dissect those words a little bit better. So that pectoralis, or your pecs in brief is called, includes both pectoralis major as well as the pectoralis minor. These have been cut away. Minor, obviously, if it were pulled away, it would still not be as impressive as that pectoralis major. That pectoralis minor being found underneath that pectoralis major, doing its own thing. If we were to cleave away further, as you had noted back here, you would see an internal and external intercostals, which we'll be discussing here shortly. But the internal intercostals, you'll see start off, their superior aspects start off more lateral than their medial, their more inferior aspects. Their inferior aspects are more medial and coming towards it. So a negative slope, if we're going to talk mathematics. The intercostals have a positive slope, meaning that their more inferior aspects are more lateral when compared to that of their more superior aspects. If we were to turn around this individual, you would see again that trapezius having some effect again on its insertion point being in the spine of that scapula. And if you were to work out those traps, you would be doing some shoulder lifts where you are trying not to abduct that deltoid, but really shrugging. That way the spine, that vertebral column being that origin point, and that scapula, the spine of the scapula being that insertion point being drawn up. You also have attached to this spine an infraspinatus, a teres major, and a minor, as well as something else that inserts into that arm is this latissimus dorsi. We're going to go ahead and take a look-see at their insertion points really quick. There's that teres major coming in anteriorly. Again, there's that teres major coming in anteriorly, as well as that latissimus dorsi coming in anteriorly and inserting into that deltoid tuberosity. Because of their situation, if they were to contract, they would not only extend and maybe even possibly hyperextend the arm at that shoulder junction, but they would also, considering if we wanted to rotate it, it would rotate this humerus medially. So helping out with that pectoralis major movement. The teres minor and the infraspinatus, you'll see grouped together onto that humeral head, or that greater and lesser tubercles. That greater tubercle we're going to go ahead and go with. of the humerus. That is there to help again with the extension as well as a uh, rotate that arm laterally, meaning you're swinging your hand out further. If you were to have it bent at your elbow joint and then start using these muscles, your hands would go out more laterally, further away from your body, or abducting almost. But the latissimus dorsi, that teres major and that pectoralis major, would be rotating your hands if you were, again, bent at your elbows, would bring those hands more medially into your midline. Let's go ahead and descend into the abdominal pelvic cavity. You will see that we have the abdominals. You have a rectus abdominis and a transverse abdominis. Rectus abdominis, again, is in line with the midline. This is your six-pack. When people say, hey, that's a nice six-pack, you might as well say, hey, that's a nice rectus abdominis, and see how people react. The transverse abdominis is just like a transverse plane in the body. It is running perpendicular to that midline, so it is transverse. You also have the internal and external obliques, both of which are running in a very similar fashion to your internal and external intercostals. Your external obliques running, starting off more laterally at their superior portion, and their inferior portion ending more medially than their more superior portion, with the reverse being true of your internal obliques. With that, we do need to talk a little bit about the muscles that help out with pulling apart your, well, also not only dividing your thoracic and your abdominal cavity, but also with breathing. This is a picture, this is a cross section, a sagittal cross, not a sagittal, forgive me, a transverse cross section of your abdominal cavity. You see here that there is the entrance of your esophagus. Your stomach should be right here, but we don't see that. So this is the inferior view of your diaphragm. The diaphragm is the muscle that is responsible for your relaxed breathing. When you're sitting here listening to this me mumble and ramble on and on, that your diaphragm is doing its job. The one thing that we do need to mention really quick is that these internal and external intercostal muscles aren't just there to look pretty or be delicious in a pork roast or a beef roast or what have you. They are there to help with labored breathing. External intercostals, when they contract, bring external air in. External brings external stuff into the lungs. Internal intercostals will cause, when they contract, will decrease the volume of your thoracic cavity and thus make internal air go out. Intercostal muscles push internal air out. Let's go ahead and end with the pelvic floor, the stuff that is making certain that your viscera isn't slopping out. You got a pelvic girdle, you got a pelvic outlet that is rather large, but you really, and you're walking up right, so you really don't want that viscera slopping out at the bottom. So what do you do? You can't also have that pelvic floor be not wide open, not especially for females, or else birthing would be a very difficult process. So the compensation is to have a floor developed of muscles. The names of these muscles you do not need to know. We do not have time to go into depth about these muscles. With that, let's go ahead and skip over into our next discussion, which will be our discussion about the upper limbs. Have a good day, and remember, you got this.